Yes, tell us about your name, and after that, you tell us how important you think having a clinic here will be necessary. And also, there are so many other clinics that are within. How important will it be having a clinic within?
The clinic is very important, especially with our society here. We have very few medical facilities. We have, of course, Mzulu Central Hospital, but Mzulu Central Hospital is a referral hospital. It only admits patients who have been referred to the clinic, who have already been to the other medical facilities, and they should, in most cases, be government facilities. Now, there are so many diseases that we suffer. Some of them are strange these days, so that when we go to the government hospitals, we tend to be congested. And well, they know what they do, but I feel having some private clinics like the SDA clinics, like the Malawi clinic, it is doing quite a lot on certain diseases which are somehow not very common, so that having a clinic like this one will be very helpful in Mzuzu here. We have this St. John's Hospital and the government hospital, but they are not enough. Mzuzu population is big. When we, especially on the pediatric side, it seems the mission hospital is doing much better than the government hospital. I have been there myself, and I have seen what problems children do face. So that having a clinic like this one in Mzuzu would be quite of a great service, especially to the young ones.
My name is Elizabeth Chasefu. I'm a clinic officer, but I also specialize in mental health. I work at the Mzuzu Health Center, which is one of the government health centers around Mzuzu City, under the Malawi district. I feel this clinic will be of benefit to this community because, as you know, yes, we have many other health facilities around, but if we look at this, it's one of the few clinics that is under the umbrella of Seventh-day Adventist institutions. So I feel that first and foremost, it's a way of preaching and furthermore spreading the gospel. Second of all, if you look at the community around, we are living in a place whereby many people, they don't have they are of low socio-economic status, whereby they can't travel long distances. Despite that the clinics are around, some of them are in long distance situations whereby they can't travel and they cannot afford. So sometimes they just stay at home even though they are sick. So this will at least help to lessen the challenges of finding that most of them, they go to the hospitals when they are very sick. And also if you look at the government hospitals that are around, they are short-staffed, so this clinic will at least assist to ease the burden, to reduce the workload that is around the other hospitals. Because many people, they go to the hospital, even other health centers, but they stay for a long time before they are assisted. So as such, you find most of them, maybe they just decide to just return back home without even receiving medications. So I also feel that this community can benefit also in terms of employment. If we have a clinic like this, I'm sure that some other people will be employed that are just staying around. As such, you find that in the long run, it will reduce people who are just staying, and violence also can reduce, because most of the young people are people who maybe would have been doing something, but they are not doing anything because they don't have anything to do. So I think this clinic can also be of help. And if we look at the fact that we have emergencies, like under 5 children, even maternity cases, whereby if they need help, they have to travel long distances, as I said before. So people around here will know that at least if they need help at any time, they can at least come near and they will not have problems in accessing health care. So if you look at also quality of care, finally, I feel that quality of care can be improved. generally in Malawi government we have a problem because we are lacking the care that is there, and you find that many people they suffer from burnout because they find that maybe at the end of the day they have to care for so many patients. So as I said, reducing workload can at least assist to improve the quality of care in health care all around. Thank you.
Chipatala ichi chikufundika kwambiri panopa. Ineyo ndini Ngalamba. I am 74 years now. Ndino chipatala cha St. John's chiri kutali, chipatala cha Town chiri kutali, ku Central kuli kutali. Mavuto oti ni Ngalamba ndine ndikafika kumene kuja ndimapezana ndi mavuto akulu. Posachedwa pompa ndini mabala tudini napita ndikala ndi chithandizo koma navulala pa njira naita ngozi. Koma chapano pafupi sindingavutike. And moreover ndi sukulu pano. Wana sukulu akadwala usiku sitingati kupita kutali. Ndiye chipatala kuti chipezeke pafupi pano tikuza kuthandizika ife Ngalamba ndi wana sukulu pafupi. Yes.
Zina langa ndine Madaiso Phiri. Chipatala chimene chitabwera ndiona tichitithandiza kwambiri. Chifukwa choti timatha kuyenda zipatala kuno kuzuzu ziliko. Komabe timayenda mtunda wautali kukafika kumeneko. Chifukwa choti ndi mtunda wautali timangapeza beuti anzathu azadza. Kuli chilaini chachitali. Ndiye kuti tikalandire chithandizo pamakhala povuta. Nthawi zati timatha kubwerera kuzala wina somawa. Ndiye chitati chabwera tiona kuti tithoza thandizidwa kumasalandira chithandizo pafupi. Muzipatala zinazi tumapeza mavuto ake ndoti nthawi zina mankhwala ngasi mzuzu ndi wankulu komanso ndikoti mpoto yese ndi wankulu. Ndiye matenda ena amatha kuchokera kumizi uko olamomuno mzuzu oti khangati kupanga lifa kandi kusento olo ku chipatala cha boma chicha kumakhala anthu ambiri. Ndiye mankhwalaso ndi ochepa boma sili kupereka mankhwala ambiri. Ndiye chitati chabwera chipatala chichi tithomazalandira chithandizo pa nthawi yake.
I am Pastor Makijo Chavula, district pastor, also church pastor for Chasefu Seventh-day Adventist Church. We hope this clinic is going to help the community. Of course, the community surrounding this place is about 10,000 or even above. The economic status is that of low, so we hope that it is going to save a lot if the clinic is established at this place. This clinic, we hope, is going to reduce the congestion of people that go to other clinics. Just close by here we have St. John's Hospital, but even though this is there, but we feel it's not enough, it's not saving enough for the community surrounding this place. And we hope if it is established, then it is going to cater. And after all, our approach is different from these other health centers because our approach caters some educative elements, preventive elements that are going to be provided. We hope, apart from being prayed for, these people are going to find some medical help at our center.